Imagine a doctor could see a patient summary in one view within just a few seconds and can make optimal decisions with that, recommend treatment plans for the patient. Wouldn't that be revolutionizing? Wouldn't that be helpful? Last week, we spoke to an expert, a neurology expert in Munich. And he was telling us the story of having one patient in his office, and he wanted to give him the best treatment alternative, trying to look for the information. But he didn't have all the information in-house. So even in his clinic, he had to make phone calls to get the right data about the patient. He had to make phone calls with other clinics to get the right information in order to give and provide the best treatment plan for the patient. And then there was a lot of time loss, and he then said, it would be so great if there is a solution out there, if we could have all patient data available in one view. Our solution at the Innoplexus AG is built on 3 focus areas. And the first focus area is our data platform called OncoCoin. We have a very strong tech and AI capability, and we are analyzing all data that is available. We are crawling more than 10 billion web pages per day, analyzing everything with our machine learning, AI, and life science language processing capabilities. We have learned about natural language processing, and we have drilled it down to life science expertise, indexing that data to make it searchable. So we have developed, so to say, Google of the pharma industry. So that is the first focus area, our data platform. The second one is the drug discovery. Drug discovery that is possible with the support of this data platform and the insights. Having biomarker identification, discovery, indication prioritization, or even clinical trials to get more information. And the third focus area is our clinical trial prediction engine. Because with the insights from the data that we are getting from our platform, we have built a prediction engine with an accuracy of more than 86% whether a clinical trial is a success or a failure. And now, this solution, again back to the doctor in Munich, we have then established an AI-powered physician dashboard so that you have all the information of a patient in one view. A patient summary with all the information, what were his last visit of the past years in this one institution, what kind of diagnoses were given to the patient, what is the medical overview of the day, what are his vital signs and records about heart pressure, blood pressure, heart rate, all the lab information in one view so that the doctor can make immediate decisions. And also the connection to medical records from previous or other patients who have similar diagnoses or diseases. And that is with the support and with the help of our AI capability possible, so that we can check with the historical data in-house what is a similar patient journey and how could this be helpful for that one patient. And even a more interesting view is the clinical trial overview. Clinical trials, and with our, again, data platform, you could see what are the current clinical trials available, and if that one patient that you're looking at, which clinical trial might be suitable for him, and whether there's still recruiting spaces and maybe that can help. So all these features in our dashboard are available, and we have built this thanks to our core areas that we have built up with Innoplexus AG. So the doctor in Munich, when he saw that dashboard, of course, he was very excited about that, because that is exactly what he needs. And now imagine the big picture. If more clinics are, if you have more clinics and you would connect that data, how much more value could you provide? When you are a doctor, you could work a lot more efficient, faster. You could handle more patients per time. Even for the patient, his treatment can be done faster. He can have better treatment plans. And maybe he sees a more relaxed doctor because he has everything on one side and he doesn't need to bother making phone calls or trying to find the information. And of course, also for the clinics, it is important because all your data stays in your clinic. We are meeting all the necessary GDPR and HIPAA compliance and data security standards so that everything stays in your house. Now that is one of the solutions. And now with our subsidiary OncoCoin AG, we are building a real-world data marketplace. A real-world data marketplace in order to enable patients benefiting from the fact when they license out their data. Licensing out their data so that pharma companies, and everything is anonymized and secured with our blockchain technology, and with the support of a smart contract transaction, people will benefit from providing their data. For pharma companies who are developing new research projects, and they need to find this one data set or patient profile in order to match with their research project. That is possible with our marketplace. Also CROs who are trying to recruit certain patient profiles for their clinical trials, they can find this one patient profile that they need in our marketplace. And the special thing about this is that the data exchange, all patients staying owner of their own data, everyone who provides their data decides and gives his approval whether his data may be used and for what it is going to be used. So the patients are staying the owner of their data. And now back again to the hospitals. If we are working with hospitals and they are giving the approval of sharing the anonymized patient data in our marketplace, how much more value we could generate and how much more we can help patients fight against incurable diseases. Our mission is to help patients fight against incurable diseases. And our vision is, in 5 years, to be the place to go to develop therapies against incurable diseases. My name is Nadine Ebmeyer. I'm the Chief Operating Officer of OncoCoin AG, and I'm very much looking forward speaking to you at the roundtable discussion. Thank you.